In this video, I'd like to show you how to change the list of statuses available for your status drop-down box. So when you first open Wolf, if you go to the Configuration utility and you go to the View menu, you go to Patient Data Codes and then Patient Status. And here you'll see the list, and this is the list of my existing statuses. But say, for example, I ran a vasectomy clinic and I wanted to know which patients those were, as they weren't part of my usual family practice. If I want to add a new status, I can just type in the box, give it a shorthand code, V for vasectomy, and if that's going to be an active patient, I can just leave it here and hit this floppy disk icon, which is Save. So you can now see that it's in my vasectomy list, or sorry, it's in my status list with saying vasectomy. Now, if that was a status for a patient that was inactive and I didn't want to see on my panel, for example, some clinics like to keep a list of patients that haven't been seen for the last 3 years, but they're not sure if they're on their panel or not. So I'm going to call it No Visit in Last 3 Years. I'm going to give it a code of NV for No Visit, and I'm going to click the Inactive box. So this means that they won't come up in my routine searches, but I can search for just the patients with a status of no visit in the last 3 years, and I can also find them if I want to click Include Inactive on any of my searches. I could be able to find them then. Okay, again, if I want to save that, I just click on the floppy disk button, and you can see it's in my list. Now, since I don't do vasectomies, if I want to delete this from my list, I can click on it. Usually the first-hand column is the best one to click on, and I can say File, Delete. Yes, I want to delete this code, and away it goes. Now, just a little note about this billable box. We generally don't need to use the billable box except in special circumstances like hospital inpatients or long-term care patients where you want the billing system to keep track of who these patients are for you. So for most things we're doing for office management, we don't need to worry about the billable box. Okay, that's all for now. See you next time.